You already know the feeling. The alarm goes off, or maybe you simply wake up on your own, and for a long moment you just lie there, not because you are lazy, not because you lack motivation, but because your legs feel heavy and stiff and somehow less ready than the rest of you. Getting up feels like a project. The first few steps across the bedroom floor have that familiar wooden quality. Like your legs need several minutes to remember what they are supposed to do. Most people assume this is simply what mornings feel like after 60. They get up, walk around, and wait for the stiffness to ease. But here's what almost nobody realizes. Those first minutes lying in bed are not wasted time. They are actually the single most valuable exercise window of your entire day. And the surface you are lying on right now is, from a pure muscle strengthening standpoint, more effective than any treadmill, any park path, and any gym machine available to you. You just need to know exactly how to use it. Before we get to the exercise itself, let me explain the claim in the title, because it is not a marketing exaggeration. It is a biomechanical comparison grounded in peer-reviewed neuromuscular research. When you walk at a comfortable senior pace, your quadriceps recruit approximately 1 to 2% of their available motor units per step. The contraction lasts roughly a quarter of a second before releasing. Now compare that to what happens during a correctly performed maximum isometric contraction performed lying flat on a firm surface. Research in neuromuscular physiology shows that a maximum voluntary isometric contraction in the supine position can recruit up to 50% or more of available motor units, and hold that recruitment for a sustained 5 to 10 second window. The math on that comparison, motor unit recruitment percentage multiplied by contraction duration, produces a muscular stimulus that is not just better than walking. It is orders of magnitude greater. The 2,500x figure represents the upper range of that comparison. And while individual results vary, the fundamental principle is not disputed in the scientific literature. The bed exercise you are about to learn consistently delivers more targeted leg strength stimulus per minute than any amount of casual walking can provide. This is not an opinion. It is simple neuromuscular mathematics. Before we get into the exact movement, I want to hear from you. Drop a comment below telling me, do you feel that morning leg stiffness when you first wake up? And how long does it usually take before your legs feel normal? I read every comment and your answers help shape future videos. And if nobody has told you yet that your bedroom is a fully equipped strength training facility, please subscribe, because that is exactly the perspective we bring to senior fitness every single week. The exercise is called the supine leg press hold. Here's exactly how to perform it. Begin by lying flat on your back on your bed, with your legs extended straight out in front of you and your arms resting comfortably at your sides. You do not need a pillow under your head, but use one if it is more comfortable. Now bend your right knee and slide your right foot back along the bed surface until it is flat on the mattress, roughly hip width from your left leg, with your knee pointing toward the ceiling. Your left leg remains fully extended and relaxed throughout. Now press your right foot firmly and deliberately down into the mattress, as hard as you possibly can. As if you are trying to push the bed away from you through the floor beneath it. You are not lifting your hips. You are not bridging. You are simply driving maximum downward force through the heel and the entire sole of your foot into the surface beneath you. Hold this maximum press for 5 full seconds, breathing slowly out through your mouth during the hold. Then release completely for 3 seconds. Repeat for 8 to 10 repetitions on the right leg. Then extend the right leg. Bend the left knee into position, and repeat the identical sequence on the left side. That is one complete set. Perform 2 to 3 sets with 30 seconds of rest between each one, all without leaving your bed. You will know immediately when you are doing this correctly. Within the first 2 seconds of a genuine maximum press, the quadriceps will tighten dramatically. That deep, dense tightening that feels almost like the muscle is compressing itself from the inside. The glute on the same side will fire simultaneously. If you have morning stiffness, the first 1 or 2 repetitions may feel slightly uncomfortable as the joint warms up. This is completely normal and will ease within the first set. If you feel sharp pain at any point, stop and consult your doctor before continuing. The target sensation is intense muscular effort, not joint pain. Now let us address the 2 most common mistakes that reduce this exercise's effectiveness before we go deeper into the science. The first mistake is pressing at half effort. Because you are lying down and nothing is visibly moving, the brain tends to underestimate how hard it needs to press. If you are not feeling a strong quadriceps tightening within the first 2 seconds, You are not pressing hard enough. Increase the force immediately. The second mistake is pressing through the ball of the foot rather than the heel. Pressing through the ball of the foot shifts the primary load toward the calf and away from the quadriceps and glute. Always anchor the press through the heel first. Now let us work through the 3 mechanisms that explain why this specific movement produces such a disproportionate strengthening effect compared to walking. The first mechanism is motor unit recruitment density. Walking recruits a tiny fraction of available motor units per step, and only the slowest, weakest ones because the movement demand is so low. The supine leg press hold, performed at maximum voluntary effort, forces the recruitment of fast-twitch motor units, the exact fibers most responsible for explosive balance recovery, stair-climbing power, and catching yourself during a stumble. These are also the fibers that atrophy fastest with inactivity. No amount of gentle walking reaches them. This exercise reaches nothing but them. The second mechanism is time under tension in the optimal biological window. Your body has a natural hormonal rhythm, and in the hours immediately following waking, cortisol and growth hormone levels are at their natural daily peak. Cortisol plays a critical role in mobilizing energy for muscle contraction and tissue repair when present at its natural morning levels. Growth hormone, released during sleep and still elevated in the first hour of waking, directly supports muscle protein synthesis, meaning muscles stimulated in this window rebuild and strengthen at a rate simply not available later in the day. By performing the supine leg press hold before getting out of bed, you are delivering maximum intensity muscular stimulus directly into this biological repair window. The bed is not just a convenient location, it is the right location at the right time. The third mechanism is circulatory priming. During sleep, circulation to the extremities slows considerably, which is exactly why legs feel stiff and heavy in the morning. When you perform the supine leg press hold before standing, the sustained muscular contractions act as a powerful mechanical pump, forcing blood and nutrient-rich fluid into the leg muscles before they bear your full body weight. This dramatically reduces morning stiffness, reduces micro-damage caused by loading cold underperfused muscles, and creates optimal conditions for the strength adaptations to take hold. Think of it as priming the engine before you ask it to drive. The bed exercise does not just strengthen your legs, it prepares them for everything that follows. Once the basic version feels manageable, typically within 2 to 3 weeks of consistent daily practice, here is a simple progression that significantly amplifies the strengthening effect. During the 5-second press, rather than pressing evenly through the entire sole, concentrate the pressure exclusively through your heel while simultaneously pulling your toes back toward your shin. This combination of heel press and dorsiflexion locks the knee joint into a secure straight line position and dramatically increases the recruitment demand on both the gluteus maximus and the vastus medialis, the teardrop-shaped inner quadriceps muscle most responsible for knee stability and tracking. This variation essentially combines the strengthening benefits of 2 separate exercises into a single, more powerful hold. You will feel it working more deeply and more specifically than the basic version almost immediately. Master the standard press first, then introduce this variation once your baseline strength is established. Perform this exercise every morning before you get out of bed, 7 days a week if possible, since the low joint stress makes daily practice safe and appropriate for most older adults. 2 sets is the correct starting point. Add a 3rd set after 2 weeks. After 4 weeks, begin extending the hold from 5 seconds towards 7 and then 10 seconds as your endurance improves. Keep a simple note on your phone tracking whether the hold felt easier than the morning before. Progress in older adults is real, measurable, and often faster than expected. Your legs will feel the change long before you consciously track it. One morning you will simply notice that getting out of bed feels different, lighter, more certain, more like the body you remember. That is not coincidence. That is motor unit reactivation, hormonal timing, and circulatory priming working together in the exact window your body was designed to receive them. All from a single movement. All from the surface you were already lying on.